Plus weakness, hearing loss, even paralysis. Up next, our Doreen Gensler explains why some locals are having severe reactions to a bug that could be in your backyard.
It's a potential health threat that could be lurking right in your backyard.
Doreen Gensler has more now on a disease that's causing major neurological problems in some people right here in the Washington area. Doreen?
Hi, Jim, Pat. This is kind of troubling. Before you step outside to do some yard work or enjoy an evening on the patio this weekend, the weather is going to clear up eventually, you may want to watch this. We're talking about the West Nile virus, something we hear about every year, but newer studies are showing that it's actually people in their 50s who are getting severely ill from the virus, facing everything from paralysis to hearing loss. Roy Goldman and his wife love to spend time out on their patio, enjoying the tranquility of their backyard oasis in Northwest D.C. But their summer fun came to a quick end in August when Roy started feeling ill.
Flu-like symptoms, very weak and tired, achy joints.
He figured it was some kind of weird summer flu until things got worse and he was admitted to the hospital.
At that point, I had double vision. My everything was just really not moving properly. I was a little delirious.
He also lost strength in his left arm and hand and had no hearing in one of his ears. Tests showed that he was infected with the West Nile virus, which he believes he got from a mosquito bite while sitting outside his home.
The virus, after the mosquito has a contact that's long enough, can be inserted into the blood of the human being, and it can spread. Often it will go, it likes to go to the brain tissue.
Dr. Robert Bunning is an internal medicine specialist at MedStar National Rehabilitation Hospital. He says while most people who get a bite from an infected mosquito won't get sick, about 20% will develop symptoms, typically a fever or headache. Of those, 1 in 150 will develop serious neurological symptoms, including meningitis, brain inflammation called encephalitis, or even paralysis. Doctors also say they're seeing more healthy people getting sick. It's not limited to the elderly or those with compromised immune systems.
Well, I don't like to think of people over 50 as elderly, but there is some data that the serious neurologic complications are more common if you're over 50.
I was exercising daily. I was mostly vegetarian diet.
Roy Goldman says at age 65, he was feeling healthy too until that fateful bite. Now, nearly 2 months since he was hospitalized, he still can't hear out of his left ear and his arm remains paralyzed. The doctors are hopeful that he'll gain full function back over the next few months. In the meantime, he says he's not afraid to sit outside, but he'll be using bug spray.
There's no way to avoid mosquitoes.
There's really no treatment for West Nile virus besides supportive care like reducing fevers and replacing fluids. Patients just have to wait until their body fights off the virus. The good news, mosquito season is ending soon. As soon as the weather gets cooler, the insects will go away. Jim and Pat, we heard a lot about West Nile virus a few years ago, and lately not so much. This is kind of an important and timely warning. Use the bug spray if you're going to be outside.
You said it. Doreen, thanks so much.